Como destacara el secretario general de las Naciones Unidas, Ban Ki-moon, en el lanzamiento de los primeros estudios del costo del hambre en Panamá en 2007, abro comillas, el hambre es una cuestión moral, pero, como lo demuestran estos estudios, son también una preocupación económica crítica. Sus conclusiones son en sí mismas un llamado a la acción, cierre comillas. Hoy tendremos también la oportunidad de conocer cuáles son esas acciones de política que han probado ser efectivas en dar cuenta de la malnutrición en sus distintas formas. De esta manera, no solo veremos la medida de síntomas del problema y características de su diagnóstico, sino también las acciones que hoy están disponibles para hacernos cargo. Agradezco a todos los panelistas y participantes por su tiempo y dedicación y les deseo una fructífera discusión que sin duda contribuirá a enfrentar estos desafíos y mejorar el bienestar en nuestra región. Muchas gracias.
Muchas gracias, Alberto, por tus palabras. Sin más, por favor, quisiera dar la palabra al señor Brian Bogart, director de la Oficina Multipaís del World Food Program acá en el Caribe.
Gracias. Good afternoon, Excellencies, distinguished colleagues, ladies and gentlemen. With protocols duly established by my colleague, allow me to extend our sincere gratitude to the government of Barbados for graciously hosting this important gathering, as well as our esteemed partners at the Economic Commission for Latin America and the Caribbean for their invaluable collaboration on this initiative. I would also like to convey, on behalf of the WFP Regional Director, Ms. Lola Castro, her deep regrets for being unable to attend today due to unforeseen scheduling conflicts. The Latin American Caribbean region holds immense promise in terms of human development and economic growth potential. At the same time, the region faces critical challenges in ensuring adequate food security and nutrition for its populations. The report before us today offers insights into these complex issues and is intended to serve as a guide for regional policy priorities and agenda setting. The Latin American Caribbean region continues to contend with intensifying food insecurity, with overall rates now surpassing pre-pandemic levels. The increasing threat of climate change exacerbates these trends, with extreme weather events severely impacting food production and livelihoods and leaving millions without consistent access to nutritious food. Furthermore, the rising cost of living has eroded purchasing power across the region, making nutritious diets less and less affordable. Alarmingly, the region records one of the world's highest costs for a healthy diet, currently estimated at $4.60 per person per day. The high cost of food has also contributed to the double burden of malnutrition, with populations facing both undernutrition and chronic diseases linked to overnutrition, with one of the highest global prevalence rates for overweight and obesity. As highlighted in the report, the double burden of malnutrition is not only a public health crisis, but significantly hinders economic growth in the region, with losses amounting to as much as 16% of GDP in some countries, such as Guatemala. These findings signal an urgent need for a comprehensive and intersectoral approach to approaching food security and improved nutrition for the region. The economic implications of inaction are stark. Failing to address the current nutritional challenges could result in cumulative costs of up to 15 times current expenditures, with annual economic losses projected to reach $13.6 billion. The World Food Program continues to work in close partnership with governments across the region to prevent malnutrition in all of its forms. By strengthening local food systems and linking these with social protection systems, including school feeding programs, these initiatives not only promote healthy diets, but also strengthen resilience in times of crisis. In closing, it is my hope that today's briefing will inspire participants to engage in constructive dialogue and explore innovative solutions for addressing the food security and nutrition challenges facing the region. Together, we can work towards a future where safe and nutritious food is accessible to all. Thank you.
Thank you very much, Brian. Muchas gracias. Por favor, Alberto lamentablemente se tiene que retirar, así que vamos a continuar ahora, darle el espacio. Brian también, por favor. Vamos a dejar entonces a nuestros expositores, quienes son también autores del documento que estamos lanzando en este momento, el cual acá está disponible en inglés y en español para quienes quieran después tener una copia. Voy a dejar entonces con ustedes a Rodrigo Martínez, quien es oficial superior de Asuntos Sociales de la División de Desarrollo Social de la CEPAL, y a Carla Mejía, quien es oficial regional de nutrición del World Food Program, quienes van a hacer la presentación del documento. Por favor, Rodrigo, adelante.
Muchas gracias, Amalia, y parto pidiendo disculpas porque al parecer hay gente que está conectada y no tiene buen acceso a la comunicación. Desgraciadamente, en este momento ya no tenemos control desde aquí de la mesa. Esperamos que se puedan conectar prontamente para tener una mejor experiencia con esto. Les comento muy brevemente de qué trata este proyecto del costo de la doble carga de la malnutrición, que aquí vamos a hacer un pequeño resumen de un largo trabajo, como mencionaba Alberto hace unos minutos, un largo trabajo que ya tiene 20 años en conjunto entre el Programa Mundial de Alimentos y la CEPAL. No me funciona el... Ahí. ¿Cuál es el objetivo de este trabajo? El objetivo han sido estimar los impactos sociales y económicos de la doble carga de la malnutrición en los distintos países de la región. Con eso, la idea es apoyar a la toma de decisiones a favor de políticas públicas de seguridad alimentaria y nutricional,
and the development of methodologies that bring a better gathering of data within different countries.
And this project we started in 2005 with the focus on child nutrition, where we did an analysis for 13 countries of Latin America and 21 countries in Africa who adopted the same methodology. Afterwards, it evolved into the malnutrition, and we took charge of the double role of this phenomenon to living with malnutrition and the excess weight and obesity and the problem, nutritional problems that we're experiencing. And in this regard, we carried out 8 studies here in the region from 2014 to 2022, where, as you can see on the screen, we were covering these 8 countries. I compliment by saying that this is a work that we're doing together with SAPAL, ECLAC, and the methodological development here in our regions with the support of several institutions, not only ECLAC and the other institutions at an international level also participated, and regional as well. And part of the comments that we have is the communication works with the director of CESAN in Guatemala. The INCAP was an agent, very important agent in this development process. I want to give some idea of the regional context in which this occurred, and in what space, in what characteristics that the region have with regard to the topic related to nutritional. We live in a experiencing several crises at the same time, and they're generated from this prolonged crisis of COVID, which affects health and the increasing cost of life of living. If we add that to several events and characteristics and catastrophes that we've experienced in the region, and this calls us this social this inequality marks this scenario in our region, a context where hunger and the double weight burden of the malnutrition and obesity, it generates is a challenge to have the necessary goods to provide good and healthy food. About 80 million people live in poverty. More than 70 million don't have the necessary resources to cover their basic food basket. They are in extreme poverty. The insecurity, food insecurity, it affects 37% of the population. There are more than 187 people, with 30% for men and 25 for women, 25% for hombre, and 30 for women, which speaks of the gender disequality in this area as well too. Also territorial inequality, which affects merely the urban sectors. The malnutrition in children under 5 years. This affects with chronic malnutrition. It's for those from 5.67 million children, and the weight of this affects 1.4%. 700,000 people, children, affected by that in the region, which have the production of food to cover a healthy diet needs. The excess overweight also is a problem with children under 10% of children overweight. It's 5.6. We are advancing more quickly than the rest of the world in regard to obesity, the problem of obesity. 49 million, which have 13 and 19 years, have a problem with overweight, where the rest of the world is 18%. We have. And on the other side, anemia affects almost 33% of the people with the preschool age, and 17% of the women have. Bearing in mind, in this variable, we have several problems with information, which has caused it not to form part of this study. When we talk about the double blow of the malnutrition. What are the impacts that the malnutrition has in the region? A more conceptual view. If we analyze malnutrition for children under 5 years, chronic and global effect in the health area with greater risk of mortality and morbidity. In illnesses, diseases such as diarrhea, acute diarrhea, the mortality increases, and we have a problem with a greater problem of mortality, and then secondly, it affects education with greater rates of cases and this causes an increase in the missing from school. This affects the productive capacity of these countries in the development of the countries, of people in these countries. So the level of schooling also diminishes among the children. And on the other hand, the overweight and obesity for those who are over 19 years, which in these cases we have not included an analysis for other just because of confidentiality problem reasons. There's an increase in the mortality, in morbidity, in diabetes mellitus type 2, and this forms part of the problems in a serious way. the screen has changed. They changed my the image has changed, and I cannot rewind. I cannot go back. And in this regard, it increases, as I was saying, the morbidity, this type of disease, as well as cancer, and several types of cancer also, and this increases the mortality and morbidity, which generates problems associated, the health problems, absenteeism, work absenteeism, and this affects there's less hours of work, and the project which we analyze the methodology, where we use information, global type information, with the exists in gives us this type of estimation, and we apply to each one of the countries, from the persons up to the whole set of people from each country. This one. Some of the results, very briefly. Infant malnutrition is. We did this study for 7 countries. We have included the case of Chile, which is less than 2.5%, which is a flat rate. And we see that there are almost 100 deaths per cases associated with malnutrition, infant malnutrition in the region. The morbidity affects with acute respiratory infections. We would not have had this if we wouldn't have the problem with dyspnea. The same thing happened with diarrhea. 37,500 persons who suffered. The intrauterine problems also talks about 33,500, and a sharp malnutrition in 64,800 patients. In the case of repetitions, there's a loss of years of study. And school, and on an average, we're talking about 2 years of loss of schooling for children who have problems with malnutrition with respect to vis-a-vis the rest of the population. Some of the economic cost of the infant malnutrition, between 500 and 22,000 of these 7 countries affected. The loss of productivity is part of the cost. Almost 2/3 of the cost of the malnutrition are because of from productivity, more than the cost of health, more than the cost for health for education. The greatest loss which is being generated in economic terms is in the and this causes us to speak directly. If we talk the problems, in addition to resolving the problem, the right of the children, what we are doing is an investment in the productive capacity, and that's the message that we want to. We think it's very important to have present in the photo. We see that there's the greatest part of these losses are associated with the productivity, by a lesser level of productivity. The loss of productivity and mortality, and thirdly, the costs in health. And we see there that the variation, the range that these 500,000 go to 22,000. This supposes a level that reaches 11%. It's worth pointing out that it's important to point out that this is we have done this for Guatemala, where that figure reached 15%. Although we have advanced, we still have a long way to go. If you go to the next slide. is another one. In the case of overweight and obesity in adults, what we identified is a 20,000 extra deaths because of mortality associated with obesity. When we talk about obesity, we talk index, in body mass index, for or 62% of that 120,000 extra deaths corresponds to men. 32% with less than under 50 years. 75% are between 50 and 70 years. The morbidity from diabetes mellitus, we have almost 11,000 of extra deaths, and cancer and others. We have all this affects 103 million work hours, is 53% in hypertension and 39 in diabetes mellitus. If I can move the slide, if I can. The next one, Alejandro. Very quickly, the costs and losses associated in both cases for the 8 countries of the regions, it tells us that the costs reach almost $507 billion. $7 billion in overweight and obesity. With the public system, the public system looks after about 70%. And the slide here shows that the weight, which has this range of costs, will go from 30% in the case of Chile with regard to the GDP, and then 50% in the case of Guatemala. And the last one, the last slide of in terms of cost, can you go back a bit, Alejandro? There. The cost of the double burden of malnutrition is go up to 28 million for Chile for the year 2030. The greatest rate is held by Guatemala, followed by Salvador and Honduras. And 6 of these countries, the cost of malnutrition is greater than what associated with overweight and obesity. And those you can see in the yellow colors, and as you can see in the graphic, we see there that Guatemala has the highest cost in the points, the red points, with regard to the GDP. Mexico being the one has the most volume in terms of economic costs. And what is important here to analyze is that how does this grow with regards over the cost of malnutrition, and this continues to be a great problem. The cost of nutrition in several countries, and this is and thinking in this document, what we have complemented with these data information, what do we have to do? What must be done? And in the last part of this document, we present what is going to is seen here. My colleague Carla is going to present what policy alternatives that we can invest in and continue with regards to the reduction of these costs that I spoke about. Thank you, Rodriguez. If you can look at the next slide, please. This is only a screenshot of what we think that can work in terms of alternative with regards to public policies, bearing in mind that for the malnutrition, the persons who create public policy should think on an integral coverage of it. One of them based on an articulation between sectors, not only in the health sector, includes the health sector, the social protection sector as well, education, and also the food section, that we can contribute to improvement of this, mitigating the vulnerabilities of the community as elements of policies that we wanted to propose to the public, the audience. One is being a multi-causal problems, but this is malnutrition, and this should be touched on in all of its areas, from the point of view not only of the health sector but also the sector of the water and cleanliness sector. The obesity is a very important factor which contributes to malnutrition because of the lack of access to public services, and also the lack of access to diverse markets, and also this disruption which exists in the food systems, which permits the population, the great majority of people in this region, access to nutrition, proper nutrition in it, and to be able to implement public policies. Poverty is what causes this food insecurity. And one is linked with the other one, and it's important that we have a strategic investment, bearing in mind this framework, to benefit also to the individual as well as the society in general. And from there, it's important that the public policies is seen in a long term. To have an adequate framework, it has basic governance systems that permit this strategic vision, long-term vision, and a coordination, intersectorial in its design, without losing sight that the focus that malnutrition cannot be measured only from the point of view of health only. Since these programs are multi-sectorial, they should be monitored adequately. In other words, they should be existing before the monitoring. The final result of the improvement of this, there should be a system that can strengthen these mechanisms of surveillance and so that these programs can go towards a better improvement of the nutrition, not only involving governmental systems but also the civil society, academia, private sector. If you go to the next page, please, we see that as with regard to public policies, specific public policies, as was mentioned previously, there's integration between the food systems, the health systems, and the social protection system to be able to confront this problem that in some countries it is really serious, and as we can see, it causes a loss of growth, economic growth, in the countries in the region, and in a region where at any rate it has been growing relatively recently. We think that we can invest in sustainable agriculture and a diverse agriculture if focusing on in the production and local distribution. This region was, as I said earlier, focus on exporting. This Latin American region, Caribbean region, is the region which exports most fruits to the rest of the world, and at the same time is the region which unfortunately has the highest level of excess weight and obesity. And in fact, it is the region that has the highest rates in regard to the cost healthy diets, and that discrepancy is owed to a disruption of the food systems, which makes it not accessible to us sometimes. And we should be focused on the food system, not only for them to be nutritional, but they must also be accessible and adequate based on our diversity throughout the whole region. And at the same time, when one speaks of the consumer, to be able to generate this demands for healthy foods, there should be public policies from the perspective of the regulation of the advertising and the labeling with regard to the consumption of processed foods. And at the same time, we need nutritional education and the promotion of healthy foods surroundings, which permit us to go beyond those barriers and at the same time, likewise, there should be an optimization of the capacities of to monitor and to have an adequate attention for infant care, and we must have social protection so that these two systems are involved one with the other, and they to assure that there is a situation which permits to better nutrition, and at the same time the surveillance, it's not only about the monitoring of this nutritional status of the children of what we are speaking about. It should also focus on the implementing the monitoring system towards programs and public policies so that we can change and plan for the interventions, improving the quality of the interventions and to reach the desired results in long term. And with that, we want to conclude this intervention, thanking the public, the audience, and the participants. I pass the floor now over to my colleague. Thank you very much, Scalia Rodriguez, for this interesting presentation of the study. There's someone who is online. We want to invite you to review the page of the ICLAC where the document is published, so that you can download it and review it more in detail, all the analysis that has been carried out, and the studies, the base studies, this analysis from the other country, which are also available in ICLAC website. Now I want to invite to great panelists which we have, who have vast experience in the topic of malnutrition, and who is accompanying us online. She is the secretary of this food security in Guatemala, the CESAN, Meridia Palmieri. I would like to pass the floor to her. I know she has to. Her time is short. Mireya, go ahead. You have the floor. We are checking the audio. Give us a second so that we can improve the reception. Yes, is it connected? We're going to wait a couple of more minutes. Meantime, the document is available in English and in Spanish for those who want to have a copy of it. It's light. I think you're not going to have any problems in your suitcase. You can take it with you, and also it is available online. As I was saying recently, we are trying to resolve the problem. Mireya, give us a few minutes. We have very little time, so that I don't know if you want to do while we wait. If anybody in the audience wants to do a consultation, I don't know if anybody wants to ask a question to the presenters, because bear in mind that our time is very short. Yes, go ahead. I don't know if there's a microphone, but if not, I will come closer to you. I just wanted to thank ICLAC and this I think this is very interesting, and I would like that this report can reach other regions in the Caribbean, which is a different type of Caribbean, which is distinct to our countries that are important, and to try to. I think it's very interesting, also, the position to position this the focus as, and to see that social inequality is a social factor which is one of the most important causes of these problems of malnutrition and obesity, and it generates relative consequences. Nevertheless, when we talk about integrate the Caribbean region, I think that these position multi-causal. It can be a bit more extensive. This morning, the Prime Minister of Barbados spoke about how the effects of the debt generate perverse effects in the social programs of the countries of the Caribbean. I think that's multi causes. The debt, the lack of integration of the countries has caused that the food can become very expensive, and it doesn't allow that these policies and recommendations can be applied in an effective manner. And that's just an observation from my perspective, to be able to see how we can reach to see if the multi-causal effects have other effects which go beyond those that we are hearing. Thank you very much for your observation. Of course, we are conscious of that. It's part of the a couple of elements we want to relate to these type of studies. The problem of the food security is not because of lack of quality food. This is a problems of access. This problem of access has to do with this inequality. The cause of the inequality, as was mentioned, some who have to the problems of debt, which affects strongly some of the countries of the region in the Caribbean region. Mireya, are you there? Can you hear us, Mireya? Yes. No, she can't hear us. We can see her. Okay, when she comes again, I hope that she can get connected. She's there with the microphone. Can you hear me? Perfectly, yes, we can hear you. I just want to close by saying the comment that we want to add. I don't know if it affects the first person. It affects the whole. She can't hear us. Media can't hear us.
Y termino diciendo, afectan al conjunto de la sociedad. Estamos todos involucrados. Y segundo, no es solo, son un serio problema, quiero recalcarlo de esa manera, y eso nos convocó a esta conversación. Son un serio problema de derecho, primero. Lo que no implica, además, resaltar que son un serio problema económico.
It is an economic problem to me also. So investing in realizing that the conculcation of the rights, which is right to nutritional food. The investment in social development is investing in economic development. And we have the notion of the sustainable development, which covers us all, and it coincides with that, and it forms part of the social dimension of that. And therefore, welcome, thank you for your observation, and that's the framework in which we want to develop this. Perhaps just to add, with regard to, we are pleased that we can we want to continue as the countries, the government of the countries. That is, if you want, in reality, this is a work coordinated with the government of the countries that we work with, and to do these studies in each one of them. From the design and to the desire of these countries to have that information, just to be able to make decisions. I think in the cases of Cairo, that dimension of how the debt affects the social protection would be a dimension, a unique dimension in this part of how the conclusions can and the recommendations can go in that direction. In regard to what Rodriguez perhaps was saying, how this in reality this is a study, of course, but nevertheless, it's the lack of nutrition really is a lack of right, more than anything else. Speaking a little bit more outside of my area, because one violates the rights of the children with malnutrition. If you deny them of a healthy lifestyle, and we must make the effort to. And if we focus only on malnutrition, we have to take into consideration that other dimension of infant obesity and infant overweight. And later on, the consequences, as we said in the report, they has very serious consequences, repercussions with regard to their future and their life. As we can see, the life expectancy reduces, and as a region, in spite of the fact that the prevalence is more than double of the world rate, and that will cause us a lot of problems in the future. Let's see if we can we have managed to contact with Mireya again. She was waiting to speak, but something is not working. Who is in control of the connections? It's not ours, no? No.
Lamentablemente no nos está funcionando la conexión con Mireya. Prometemos hacer una reedición de esto para que y poder compartir la información de manera directa y poder ojalá tener un mejor momento de discusión y compartir en un tiempo más tranquilo. Así que, Amalia, muchas gracias.
Sí, nada, solo agradecer a quienes se tomaron el tiempo para venir. Muchas gracias por estar acá. Muchas gracias a los presentes. Perdón, viceministra, por favor.
Si me permiten no sustituir definitivamente a la secretaria de la CESAN en el tema, ella es una experta y ha tenido mucha experiencia, pero desde la perspectiva de Guatemala, y solamente enfocarme en lo que es el ámbito del Ministerio de Desarrollo Social, la protección social como tal, comentarles, viendo los datos, viendo la información sobre Guatemala, nosotros podemos...
We can see that we have a debt of social protection with respect to not just malnutrition, but also poverty. We have not established or institutionalized a system of social protection. And secondly, the establishment, what gets my attention, the recognition of political systems to adjust so that families can, and it is an opportunity to use these monetary transfers in programs directed towards malnutrition. They do not represent really an investment, not just for homes that are beneficiaries, for social spending that is less than 1%. We, as a government, we are always in permanent partnership. We have a marriage with the Secretary of social programs, and we take these recommendations very seriously because we know that the basic finances have increased, and they need to they require nutritious food meals, and we're always in constant comparison, and they complement these prices that can support the access that these families have. 16% of population in extreme poverty, and a percentage in general poverty. From the part of policy, it helps us to make better decisions.
Gracias, viceministra.
Thank you. Let us try to a mixed communication, and let's see if from the computer he can hear Mireya. So I'm going to allow her to speak, although it's not.
¿Me escuchan? Rodrigo, ¿te escucha? Perfecto, gracias. Bueno, agradezco a CEPAL en la persona de Rodrigo Martínez, gran amigo de Guatemala desde hace muchísimos años. Gracias a la Oficina Regional del PMA por esta posibilidad de compartir con ustedes algunas reflexiones sobre la importancia de este estudio para un país como Guatemala. Resulta cómico para decirlo.
It seems comical to say it in that I have participated in the second phase of the study. Possibly, although you might not know, that ECAP has a Central American mandate contracted to accompany the processes of election and analysis of data for 4 countries, and I was at that time within the institution, and today I have to comment about the use and how the authorities in the new government of Guatemala, how we are going, and we are in fact making use of the results to reorient the public policies. First of all, I would like to say that the results of this study, they have been very important for access and for the new government. They have allowed us, obviously, to open up the definition of the problem, and we are absolutely clear on the subjects of malnutrition in Guatemala. I'm not going to pause on that, but it's obvious that Guatemala, despite having the prevalence in malnutrition, we have big problems of obesity that together make the problem a very complex one, very complex above all. For the answer to this combination, we in Guatemala realized a modernization of the food program, feeding program, and thanks to studies like this one, we've been able to amplify the definition of the problem, which propels the policy. And our new policy creates an important advancement in redefining the problem, which should solve the policy and integrates new interventions to the environment of coordination that is responsible for we're the Secretary of the food policy. And in the new government, we have incorporated statements of malnutrition in the policies of government. The general policies of government has 7 includes malnutrition as a strategic subject part of the new policy. We have been working with the results of this study to redefine and redirect which are the institutions that should respond to the issues of malnutrition. And we have included also new interventions in the policy and in the strategic plan of the institution that are going to regulate the prevention of malnutrition. The challenges, I would say, the main ones that we have are the ability of institutions, issues of malnutrition. There's a tendency to want to insist in the issues of disnutrition, and so we have to reconceptualize these subjects, these matters, and the determining factors and the interventions to prevent more than attend. I would say that we've advanced a significant amount in the analysis and the multidimensional analysis of the problems of malnutrition. This has been clear in different initiatives that we have under CESAN. Our mandate is coordination and generation of we don't exercise programs, but we strengthen managerial subjects, and through the new programs and new interventions of this government, we are directing the task at the level of initiatives where we've created, well, not created, but we know that it's very important to all of the government departments that they can redirect the work, the institutional task of diverse nature. And so I would say that this is a challenge. The local task at an institutional level. The Guatemala state is a centralist state where there are difficulties of coordination at a central level. Imagine coordinating at a historic level, but we know that we are sure that the formula for success in which we are betting. And I say to conclude, the most relevant, I would say, is modifying a little bit the priorities at an institutional level. So that's why I said that the institutional capacity is a big challenge for us, and so there we have to do a lot of work changing priorities, changing plans, strategic plans at the institutional level, and all of these changes, paradigm changes, are a challenge, and we know that it is important for this government, and we know that we're not alone. And in this sense, we have been aligning the international cooperation so that it supports the new government in their priorities of combating and fighting against malnutrition. I'll leave it there. Esteemed attendants, I'm very sorry that we've had these issues, but it's been my pleasure Rodrigo, you can share my information, my contact information, and with much pleasure, we are able to respond up ahead any questions or any requests for information about the framework, the political framework of the new government of Guatemala. Thank you very much for listening. Thank you, Mireya. We're sorry that we had these communication problems, but at least we achieved a form of communication. The technology didn't help us much in the beginning, but it helped us in the end. Thank you very much. And kiss and goodbye. Excuse me. With this, let us finalize the event. Thank you to everyone who has attended. And now we want to invite so that they can continue with CISA.